This was developed by Crescendo Bioscience as a multi-biomarker for assessing rheumatoid arthritis or inflammation, or inflammatory arthritis activity in patients with disease-modifying agents and biologic drugs. It assembles a panel of 12 key proteins that have been associated with rheumatoid arthritis in one test, which produces an objective quantitative score related to disease activity. The score, which is 0 to 100, helps doctors and patients make treatment decisions as they go forward. Lower the score means less disease activity. Interpreting your score is essential. 45 to 100 indicates high disease activity. 30 to 44 indicates moderate activity. 1 to 29 indicates low level of activity. It is not used for the diagnosis of rheumatoid arthritis, but to assess disease activity. The level of score can help with predicting possible radiological progression or joint damage with rheumatoid arthritis or inflammatory arthritis following the degree of disease activity. Low disease activity will be less than 29. There's a 0 chance. Moderate disease activity, which is 30 to 44, 3.4%. High disease activity greater than 44 is 20.9. Your disease activity was high. If the joint swelling stiffness persists, we may need to consider medications such as prednisone, DMARDs, biologics, which are discussed in the subsequent slides. At this time, I suspect you have inflammatory arthritis, which is inflammation in the joints. So classified as autoimmune diseases, inflammatory arthritis is a grouping of types of arthritis involved in the immune system. In autoimmune disorders, the body sends errant messages to cells with immune function, including white blood cells, instructing them to attack the body's own tissue. The damaged tissues cause deformity, instability, scarring within the joints. These diseases are characterized by the presence of white blood cell in the joint fluid. One of the most common types of inflammatory arthritis is rheumatoid arthritis, also known as RA. But in this case, the tests for rheumatoid arthritis were negative. Now, one of the medications that we may consider is corticosteroids or prednisone. For persistent joint pain and swelling, a medication called prednisone may be considered for treatment. These are also called steroids, and they're a type of steroid hormone to treat many types of conditions such as inflammatory arthritis, asthma, Crohn's disease, and systemic lupus erythematosus. It's a class of drugs called corticosteroids, which reduce inflammation and suppress the immune system when used in patients with inflammatory arthritis. It's typically given orally. There are two ways these medications are thought to work. One is by stopping the production of certain pro-inflammatory cytokines. The second way is that, like prednisone, they act like COX-2 inhibitors, which are non-steroidal anti-inflammatory agents that target an enzyme called cycloogenase 2, which is responsible for pain and inflammation. Steroid medications work quickly to decrease the swelling, warmth, tenderness, and pain associated with inflammation. They do this by lessening the immune system's response. It can be helpful for a patient with lupus and may be also prescribed for patients who haven't responded well to Plaquenil. The side effects depend on the strength of the dose and for how long you take it. Side effects of prednisone range from gastrointestinal upset, which includes diarrhea, stomach pain, and neurological, psychiatric, which include mood swings, insomnia, to ophthalmic with blurred vision and cataracts, and endocrine and diabetes hyperglycemia. Taking prednisone can dramatically weaken your bones, leading to osteoporosis, and may cause cravings that cause weight gain and increase your risk of infections. But rheumatologists try to keep patients on the lowest dose possible to minimize these side effects. Calcium and vitamin D may also be recommended to minimize the effect. Now, a group of drugs that we use to help with inflammatory arthritis are called disease-modifying anti-rheumatic drugs, or DMARDs. These include medications that help slow the progression of joint damage from rheumatoid and inflammatory disease. They are an overall part of the treatment plan. They act on the immune system to slow the progression of rheumatoid arthritis and inflammatory arthritis. This is why they're called disease-modifying. Many different drugs are used as DMARDs in the treatment of rheumatoid arthritis, but some are used more than others. There are 5 medications to consider: Plaquenil, sulfasalazine, methotrexate, arreva, and monocycline. We'll explain each of these. Plaquenil, its generic name is hydroxychloroquine. It's used for mild rheumatoid arthritis. It's not as powerful as other DMARDs but can cause fewer side effects. In rare cases, it can adversely affect the eyes, and patients taking this medication need to be seen by an ophthalmologist. For rheumatoid arthritis or inflammatory arthritis, it's given in a dose of 400 to 600, sometimes lower, administered as single dose or in 2 divided doses. In a small percentage of patients, side effects may require temporary reduction in the initial dose. When a good response is obtained, the dosage may be reduced by 50%, and maintenance doses may be continued. Arginine is another disease-modifying agent. It can decrease the pain and swelling of arthritis, prevent joint damage, reduce the risk of long-term disability. It is a type of sulfa drug, and if someone has a sulfur allergy, should not take it. It's used in the treatment of inflammatory arthritis, inflammatory bowel disease, and other autoimmune conditions. It works to lower inflammation of the body. Most patients can take it without any problem, but the most common side effects are nausea and abdominal discomfort, and other serious side effects include stomach ulcers, which are less common than patients taking non-steroidals, such as ibuprofen. The abdominal side effects do improve with time and often avoided by slowly increasing from low starting doses. It also comes in an enteric-coated, stomach-coated pill. Sun sensitivity can be a side effect, and those on sulfasalazine should have sun blockers of 15 or higher. Some people will have orange-colored urine and orange skin. This does not cause alarm and goes away, usually after stopping the medication. In some cases, sulfasalazine may reduce the number of disease weight-fighting blood cells, and this is a reason for blood checks. It comes in a 500 milligram tablet to be taken with food and a full glass of water to avoid an upset stomach. It's started at low doses when treating rheumatoid or inflammatory arthritis to prevent side effects, typically 1 to 2 tablets a day. After the first month, the dose may be slowly increased up to the usual dose of 2 tablets, 1 gram twice a day. At times, it can be increased to 6 tablets a day. An enteric-coated preparation is available. But that should not be crushed or chewed. An adequate fluid intake is required to prevent kidney stones. It may take 2 to 3 months before notable improvement is noted. Methotrexate. This is one of the more commonly used DMARDs. That is because it has been shown to work as well or better than any other single medicine. It's also relatively inexpensive and generally safe. Like other DMARDs, methotrexate has side effects. It can cause rash and stomach upset. It can be toxic to liver or bone marrow and can cause birth defects. In rare cases, it can cause shortness of breath. Regular blood work is necessary when taking methotrexate, and folic acid helps reduce some of the side effects. Its biggest advantage is that it has been shown to take for long periods of time and can even be used in children. You can take 7.5 to 10 milligrams each week, but a recommended dose is 15. It takes 3 to 6 weeks to start to feel the methotrexate working, and sometimes even longer to get optimal or full effects. Blood tests will be needed every month and then every 3 months. Hepatic screening will need to be done. Arreva, or leflunomide. This works about as well as methotrexate, can work better in combination with it, although don't always recommend that due to the liver function test effect. The side effects are similar to methotrexate. Sometimes arreva causes diarrhea and can't be used. It has been known to cause harm to the fetus. Women must take special precautions to prevent pregnancy. It is given as a 20 milligram tablet once a day. Sometimes patients are only given 10 milligrams if they experience side effects. It should be taken with food. It may take several weeks after starting leflunomide to experience an improvement in joint pain or swelling. Complete benefits may not be experienced until 6 to 12 weeks after starting the medication. Blood tests will be needed each month and then every 3 months. Hepatitis and TB screening will need to be done. Monocycline is another DMARD that is not often prescribed, but it may help rheumatoid arthritis and inflammatory arthritis by stopping inflammation. It may take several months to start working and up to a year before the full effects are known. When taken for long periods, monocycline may cause discoloration of the skin. Imuran is another additional medication that's used for different inflammatory conditions, including inflammatory arthritis. Most common side effects are nausea and vomiting, sometimes stomach pain and diarrhea. Long-term use has been associated with an increased risk of cancer. Another medication that is used for inflammatory arthritis or rheumatoid is cyclosporine. It's a powerful drug that often works well in slowing down joint damage. Because it can hurt the kidneys and has other potential side effects, it's usually used for severe rheumatoid arthritis when other drugs fail and is not widespread at this time. DMARD side effects. The FDA has approved most DMARDs. Most people take them without ever having problems. They work throughout the body to fight RA or inflammatory arthritis. Their powerful action typically does cause some side effects, which include stomach upset and nausea and sometimes vomiting and diarrhea. Liver problems, they're less common than stomach upset, but that's why we do regular blood tests. And blood problems. DMARDs can affect the immune system and raise the risk of infection. Infection-fighting white blood cells may be also decreased, as well as anemia can occur. A simple blood test by your doctor every so often makes sure the blood counts are high enough. Biologic response modifiers are the newest class of drugs to treat rheumatoid arthritis or inflammatory arthritis. These modern biologics have greatly improved treatment for many people with rheumatoid and inflammatory arthritis. Unlike older disease-modifying drugs, biological DMARDs are using biotechnology. They're genetically engineered to act like natural proteins in your immune system. They don't cure RA or inflammatory arthritis, but they can dramatically slow its progression. They also cause fewer side effects than older drugs. People who don't respond to DMARDs such as methotrexate may benefit from treatment with a biologic. Sometimes may give it alone or in combination with a medication. The available biologics include Actimra, Cimzia, Enbrel, Humira, Kineret, Orencia, Remicade, Rituxan, and Simponi. They are sometimes better controlling RA progression than DMARDs. This is because they are specific target mediators of rheumatoid for inflammation. Older DMARDs work by suppressing the immune system in general. Modern biologics for RA work in different ways in the body. Abatacept works by crippling the type of white blood cell called the T cell and plays a role in inflammation that causes RA. Many biologics work by interfering with the activity of tumor necrosis factor, and such as the following medication. Rituxan appears to help control RA by destroying another category of immune system called B cells. These actions are not fully understood. Anakinra blocks the action of immune system protein called interleukin IL-1. There is another medication called Xeljanz, which is a non-biological solution. This is a new class by itself. It is also called a Janus-associated kinase inhibitor. It works by blocking a cellular signal pathway inside cells. This stops components that cause inflammation from being made. Older biologics block inflammation from outside the cell, but JAK inhibitors work from within the cell. This is not an injection, but comes as a pill. It's taken once a day. Another medication called Illuminate is another JAK inhibitor, is also oral and is taken twice. Now, some of the side effects include lung infections, liver damage, reduced ability to make new blood cells, nausea, pain, and swelling. Because these medications target specific parts of the immune system to reduce inflammation in joints. They have fewer side effects. However, any drug that suppresses the immune system carries a risk. If you happen to have a side effect or unusual symptoms, please tell your doctor. Sometimes a dormant infection may become active, and for this reason, a tuberculosis test and a hepatitis test will need to be taken before we do this. Now, there is a possibility of shingles with biologics and rheumatoid arthritis. People with rheumatoid arthritis have twice the risk of healthy older adults developing shingles, a virus related to chickenpox that causes pain and blistering rash. The best way is to get vaccinated against the virus with Shingrix. This is a new vaccine which was approved in 2017 for the prevention of shingles. It is a non-live recombinant subunit vaccine given intramuscularly in 2 doses, 2 and 6 months apart. It's important to complete the course and receive both injections. Thank you.